Okay, good afternoon, everyone. It is my great pleasure to welcome you all to this pivotal side event in the margins of the 78th World Health Assembly. My name is Laura Bloom and I'm the Vice Chair of IAPO, and we're going to be hosting this in partnership with the Civil Society Engagement Mechanism, CSEM, for UHC 2030. Thank you all for joining us for what promises to be a really engaging and thought-provoking session on the power and potential of social participation in shaping health systems that truly serve all people everywhere. Every year, IAPO commits to holding a side event to bring the voices of people with lived experiences to discussions happening at the WHA, and we are really looking forward to this conversation. As you all know, we are living through a moment of both immense challenge and unprecedented opportunity in global health. As the world continues to recover from the pandemic and faces new waves of instability and economic constraint, there is a growing recognition, long overdue, that meaningful engagement of people with lived experience, communities, and civil society is not just a nice to have, but a must have for resilient, people-centered, and equitable healthcare systems. This recognition reached a new milestone last year when the 77th World Health Assembly adopted the landmark resolution on social participation for universal health coverage, health and well-being. It was a powerful affirmation of the principle that health is not just something done to people, but it is something done with people. It enshrined the idea that genuine, structured engagement with people with lived experience and communities is essential, not only for better outcomes, but for more accountable governance. IAPO is excited to be steering the creation of a patient charter on social participation as a stimulus for the community after this year's assembly. And Danny will be speaking more about this at the end of the session. And it will be co-created by the global patient organization community as a rallying tool, an advocacy resource for working with governments, and it's the aim to launch it later this year. IAPO has really been relentless and pioneering in this movement for over 25 years. And today, with our new strategic framework, the face of IAPO, facilitation, advocacy, collaboration, and empowerment, we stand ready to be a guiding force in operating this mission. And through platforms like today's events and tools such as the newly launched UHC Compass, we are equipping patient organizations around the world to lead the way in making social participation a reality, not just in Geneva, but in communities everywhere. 1 year on, the implementation of this resolution has not moved as quickly as we hoped. The WHO itself is undergoing significant internal restructuring, and governments are grappling with competing priorities. And this makes this moment, this session, all the more vital. We are here today to not only shine a spotlight on the importance of the resolution, but also to reaffirm the global patient community's unwavering commitment to bringing it to life. We are here to examine what is working, where the roadblocks remain, and how we can work together across sectors, across countries, and across experiences to ensure that no voice is left unheard and that no one is left behind. So during our time together today, we're going to learn about the current status of the resolution's implementation and how civil society can support the WHO and governments to ensure momentum. It's going to explore the role of social participation as a driver for UHC, with the UHC Compass as a key enabler. We're going to share powerful examples of what patient-led advocacy can really achieve, both at the policy level and in the lives of individuals, and raise key asks to governments to ensure the meaningful engagement of people with lived experience in health decision-making at the national level. This isn't just a policy conversation. It's about people's lives, communities' dignity, and the kind of health systems that we want to build for future generations. And it's not happening in a silo. We are delighted to see other events on social participation throughout the week and side events with the patient organizations taking part today. We're going to have more information at the slide at the end of today's session if you would like to attend any of those. So thank you for being here. Thank you for your commitment and for your voice. Let's really make this session count. I'd now like to invite Waisa Ngwanga, coordinator at CSEM, to also share a few words about this side event and our wider collaboration. Waisa.
Thank you very much, and I'm great to see everybody here. My name is Waisa Ngwanga, and I'm the coordinator of the Civil Society Engagement Mechanism for UHC 2030. IAPO has been a great partner for us since the very beginning of putting together the resolutions of participation, and we've worked together to really mobilize stakeholders to take the necessary steps to move the resolution forward. So thank you for your support and leadership and partnership. At the CSEM, the Civil Society Engagement Mechanism, sometimes we call it CSEM, we believe very strongly that the best way to build responsive and equitable health systems is through social participation and community engagement. And this is at the core of everything we do at CSEM. And we also believe that the best way for government to achieve that is to actually engage the end users of those health systems. So patients and patient organizations need to be at the table at every stage of the decision making in the health systems. We want to hear the stories. We want to hear the voices. We want to hear those experiences of the people that use the health systems. And it's the best way that we can make the progress we want to see in the world toward the UHC and to ensure no one is left behind. And over the last, I would say, actually almost a year now, we have a system working together with partners, civil society partners, including IAPO. We have really made it our goal to make sure that member states follow up on the resolution and social participation on the commitments that they made last May. And to that end, we have developed a suite of resources, useful resources for advocates to push their governments, all of us, to push our governments to take concrete actions to implement the resolution, and also to ensure that specific communities are reached and engaged and involved. We will have many conversations on this topic this week, and I invite you to not only join these efforts to push governments, but also to join us on Wednesday for more conversation on this topic. I think it's about 12:30. We will have a conversation here on how we can move this collectively forward. Thank you, everyone.
Thank you, Waisa. It's an absolute honor to co-host this side event with you. I'm now going to pass the floor to Danny Mothi, IAPO's CEO, who will moderate the panel, where we'll be discussing the WHA resolution on social participation. Over to you, Danny.
Thank you, Lara, and thank you, Waisa. It's such an honor to be holding this side event here today and also having this set of speakers at the table. These are the big players who have been working tirelessly for this resolution to come out of the paper and become a reality. So I'll introduce each one of them while I share the questions, and I would love to start with Nanut Mathurapod. She's the head of the Global Collaboration Unit from the National Health Commission Office from Thailand. And Nanut, I would love for us to start here talking about why should governments invest in social participation? What's the value in this? But also, how is Thailand approaching this?
Thank you very much for inviting me here. And I have heard IAPO for a long time. So it's very honored to be here. But actually, this question, we should reframe it why shouldn't government invest in social participation? Look at the uncertain situation right now, like not climate change, but climate emergencies, economic recessions, and next coming pandemics. So I think the government is too small to solve big problems, and it's too big to solve small problems. That's why partnership with civil society, particularly patients, will actually strengthen the government's. And I think the government in general should see people, especially patients, as a valued asset because they can contribute to societies or improved health system. We can transform people to be health volunteers, to be active citizens and civil societies, and transform patients from beneficiaries to service provider, which we do in Thailand. So, so let's see the slide that I would like to show you that we have public hearing for universal health coverage annually. But beyond healthcare, we have the National Health Assembly to consult and come similar to World Health Assembly, but the difference is the participant, which is not just government, but also civil societies and academic and youth. And the issues is more health and well-being. For example, this year will be the agenda on silver economy and energy transition. So this is the platforms that we're doing, but we not just open access to participation, but we giving the more enabling environments and factors. For example, we have budget and funds, especially financial mechanisms. We build capacities of civil societies and health volunteers. Laws and regulations are available to support the governments to do, and more, and importantly, when we have WHA resolution on social participation for UHC health and well-being, this is more, we can leverage it at the national level. So this is why the government should invest in social participation. Thank you.
Yeah. Thailand really deserves a clap. Thailand is among a set of countries who came up with this resolution, and there are a lot of countries that are not yet supporting the resolution. But hopefully, with our advocacy work, we'll be able to bring more and more countries to this agenda. And that leads me to my next question, which is to Gabriele Pastorino. Gabriele, he works for the WHO, and he's been collaborating with the member states to support them in the implementation of the resolution. And it's been 1 year. And I'd love to hear from you, Gabriele. If you could share some insights on how the resolution implementation has been unfolding, but also the challenges that you have been facing and that have emerged on the way.
Thank you very much, and good afternoon, everyone. I mean, it's a real pleasure to be here. I would like to start by really commending IAPO, CSEM, and all the civil society organizations that are doing their best to keep this agenda high and to support the implementation of the resolution. We need that more than ever, and you are a key partners in that. So it's really great that you're doing this work to raise the attention and to keep the attention high on this very important topic. It has been a year, and just a year ago, the 194 member states of the World Health Assembly approved this historical resolution. But we also know that the world we are living in is very different from 12 months ago. And I would like to start maybe with before we go into the challenges, which are real, and I think they go beyond, in a way, just the implementation of this resolution. But I would like to start with maybe the positive. So the positive is that we have been working a lot, particularly in the first 6-7 months after the resolution. So until I would say December, January this year, a lot has been happening. I would just like to mention some of the things that we have managed to pull through. When the resolution was approved, we had a special issue of EuroHealth, which provided a number of scientific articles that unpacked even further the WHO handbook that was published originally in 2021, which is the kind of normative bedrock from WHO on the topic of social participation. We managed also last year in the summer to publish the first 2 policy briefs for the European region, which looked at why social participation is central to health system governance, and then deep dives into why social participation has to be institutionalized. And we provided a lot of examples from countries, really explaining in practice what does it mean in health policy on the ground. We held the first multi-stakeholders policy dialogues in Central Asia, hosted by the government and with a lot of civil society actors around the table discussing this topic together. We established a community of practice within WHO to ensure that as an organization, the different departments speak the same language and we keep each other updated on what we are doing that contributes to actually progress this agenda at global level, but also at regional and country level. We pull off the first study visit and exchanges in Slovenia and in Thailand, where a multi-country delegation could learn from leaders in this field how it works on the ground. And finally, we actually, thanks to Thailand again, we had, which they hosted a very important meeting last November, where we actually spent a few days with a core group of member states and representative of civil society trying to imagine how a global network on social participation that would support this resolution would function. And we started thinking about how to design a WHO monitoring and evaluation framework, which is one of the commitments that WHO has taken with the resolution. So a lot has been happening. And as you know, the resolution has 2 operational paragraphs, one that mandates WHO to do certain actions, and then one that asks countries to make progress in their own national settings. We are facing challenging. I mean, the global health landscape has dramatically changed just in the last few months. I would like to mention one thing which I think explains a lot of how our work has been changing as well. As you know, there has been a dramatic drop in ODA, particularly in low and middle income countries. And actually, my colleague from the UHC partnership managed to run a rapid survey, a stock take, where 108 countries worldwide reported back on how the ODA disruption looked in their national settings. And the numbers are staggering. I mean, 80% reported cuts in ODA for health system, and 70% and health system disruption, and 70% reported severe service disruption, being these, for example, services related to malaria, to TB, to HIV/AIDS, but also to vaccination and CD services. So more than 50 countries, on the other hand, reported that they needed support from WHO on governance, and particularly on national health planning, which is one of the most natural entry point for social participation, is at the very beginning of the journey, because we know it's not just designing, but is about the delivery, also the monitoring and evaluation. So the entire policy spectrum and the entire policy cycle. So I just wanted to mention these numbers because these, on one hand, represent a major challenge for these countries. It may represent also an opportunity. We know that many countries will have now to rethink, for example, how they integrate vertical programs into the mainstream health system because of these cuts, and maybe in primary healthcare. And I really think that in all these areas, social participation can really play a major pivotal role to get things right, because this is about equity, is about justice, but is also about making the system more responsive to the vulnerable ones' needs, and eventually more effective. So we see a lot of challenges, but we also see an opportunity. I think we have to work with the member states to actually address it. And then the second challenge, which has been mentioned in the opening, of course, is under the eyes of everyone. This is a crucial week for the World Health Organization because we are going through a major restructuring. So we will become a smaller organization, more focused on certain priorities. And I mean, we will know probably at the end of this week what will be also this agenda, because it's very important. We have a resolution, but the money is tight and the organization will have to decide what is going to prioritize. And it's hard for us now to say whether this work will continue as it has started. So there is a lot of uncertainty, but I think we have to stick to the positive part of it and work very closely with the countries that have been leading this agenda, and Nanut has been a real driving force to actually get this through. And many countries that I see in the room here, I mean, the core group, we had Brazil, we had Slovenia, we had France, Norway, Tunisia, and many others that sponsored the resolution. But I think it's time to kind of bring everybody again on board, the civil society organization, and really work together to continue implementing the resolution. Thank you.
Thank you. And I couldn't agree more with you, Gabrielle, because I understand that things are delayed on the implementation side from the government, but there's so much that we can do on the ground, knowledge and expertise, and gather what we have been doing as civil society for many, many years, filling the gaps of service delivery, implementation. And now we can really share this and work more closely with the governments and whenever they are ready for implementing the resolution. Now I'd like to move to Ravi Ran. He's here representing the WHO Civil Society Commission, and this commission, I think, was created 2 years ago, and I'm very glad that it exists, and it exists in a time where we are talking about social participation, because I can see how much one can feed the other. And Ravi, can you share with us how the Civil Society Commission and other WHO platforms can be best harnessed to support a comprehensive but also a systematic approach to the implementation of the resolution and the reporting of the resolution as well?
Sure. Thanks, Danny, and thanks all for organizing this session. Really pleased to be here. First, just to start, how many of you know that your organization is already part of the WHO Civil Society Commission? More than I expected. Okay, so it's still not half. That's okay. Out of the tens of thousands of civil society groups, NGOs, community-based organizations, et cetera, around the world, less than 500 are in the commission. So if you're not alone. And you can talk with Eliana is here, John is here. Three of us are three representatives of the steering committee who can help you if you want to find out more or even apply to join. So first, what is the commission and what does it do? Very briefly, our role is to help WHO work more effectively and strongly with civil society. And Nanut had a great slide up just a few moments ago where she showed how the government of Thailand does that on its own. Can you hear me okay? Good, okay. So that's our main mandate. It's not to be disease specific, health topic specific. We're not on health systems or any specific issue. So that means we don't substitute for WHO's own technical consultations. And many of you who are working with specific groups may have contacts in WHO, and that should continue. We don't want to substitute for that. What we want to do is strengthen how those kind of consultations work, and also see what can we do together as civil society to strengthen what WHO can do for health around the world. Not global health, but really community health. So I hope that's clear. When it comes to the social participation resolution, I'm going to give an example. We didn't know about it until Nanut and her colleagues came to us and said, we want to talk with you about a resolution that we are proposing. And so credit goes to them, and they tested some of the ideas in a virtual consultation, 2 of them actually, with members of the Civil Society Commission. And we were rapidly trying to understand, where did this come from? And we're just so pleased. Manoj, I hope you've seen, we've actually done a chapter on you in a report. So I think that's important. And I'm bringing it up because there's an analogy here. And as IAPO and its constituent members are coming up with a patient's charter, if I've got that correctly, patient's charter on social participation, we in the Civil Society Commission can work with you and bring that out to wider civil society and to WHO. WHO is not sleeping on this. I'll highlight, and I don't think we have anyone from the HRP program, but Sexual Reproductive Health and Rights in WHO is working on a guidance document for social participation on sexual and reproductive health and rights. I think that's very important because we know that it's already under attack. And so it's very timely as well. But what I'd like to say is that I'd like you to see the commission as a resource, whether you're an organizational member or larger civil society. Take this as a resource where you can test ideas. We also have other avenues where we can support the work. And that's not just convening civil society and groups within WHO, divisions, departments, et cetera, but we are reinstituting the DG dialogues, where we have direct discussions with Dr. Tedros. Those were started during the emergency phase of COVID and then fell off. And now that we have the commission up and running, we want to bring those back. I think this would be an incredible point to bring out. And so I'm actually mentally logging it along with the NCDs, which have a high level meeting in September. I want to see that we get the patient's charter also as something that DG is aware of, because in his remaining 2 years in office, he should be able to be your advocate and our advocate for this kind of work. I don't want to talk too much because I know we'll have an open discussion. And you mentioned reporting, right? We are struggling with metrics, and I know you're going to come up with something in terms of what do we want to look like. My suggestion for what would we want to see as a reporting about social participation is not just as a citation of the National Health Assembly or things like that. I'd like us to go back to our people and say, do you feel that you are adequately consulted and that your ideas are in some ways reflected in the policy and program that emerged? I think if we don't go back to our people, we're really missing the point. So that's where I would say the reporting needs to be. Thanks, Danny.
Thank you, Ravi, and I'll hold you accountable for the patient charter. And I'm very glad with your suggestion. And also with the fact that you've mentioned about getting back to our people and asking what's their metric, because that's how we should start this work. Now I'm heading back to Nanoot, and I'd love to hear from you, Nanoot. What do you see as the main opportunities, but also barriers for governments across the globe in implementing the resolution on social participation?
I mean, at national level, I think there are 3 myths about social participation. The first one is participation slows decision-making process. And actually, no, not at all. It take time, definitely, but it make the decisions well-rounded and actionable. And actionable, that's very important, because sometimes you have policy, but it cannot implement on the ground. The second myth is, I think only experts know, which is, and they see like the public doesn't understand the complex issues. So I think actually lived experience, especially from patients and civil society, can supplement expert knowledge. And once the governments provide data and knowledge to public, they can reflect it directly through their experience. And the third myth is participation is just a meeting. That's it, because that's actually participation is the process from us. It's the process to co-design, co-produce, and co-decision, and even monitoring, co-monitoring as well. And if they understand that actually participation is a process, then the skills of government should be work on how to design the processes, how to organize platforms in a participatory manners. So this is at the midst from, I think, at the national level. So what we have to change is this is now that they have to change this kind of thing by, I think, first of all, although according to the resolutions that request what members they're supposed to do, I think the first thing is the mindset and also capacity of government officers, especially working on in health field, that they are more feel like superior to patients. So this is the very important thing, which is we don't need money, we don't need budget to do this that much, right? So I think the opportunity is I think it's now, because look at the COVID-19, the countries that get back better and faster is the countries that work on social participation before, that have community strength already. So in the near future, I think the crisis coming, everything is uncertain at the moment. So if the government start doing it and build trust with people, with civil society, it will be the right time to do it. Thank you.
Thank you, Nanut. And I think you brought up something that we have been discussing a lot, which is not everyone understands what or sees what social participation is, and don't realize that what they are already doing is social participation. So thinking about my fellow Brazilians in the room, part of the National Health Council in Brazil, or part of boards or committees within the Ministry of Health, where there is a space and a seat at the table for patients and people with lived experience to co-create something or make a decision together with the government. So I'd love to invite you all here today to think what's happening in your country that resonates with this, that it's happening here, because I'm quite sure you find many examples of social participation on the ground. And this is what we need to identify, map, and share with governments. So this resolution is about social participation to advance health, well-being, and universal health coverage. And next to me, I have a very active and engaged advocate for universal health coverage, Pam Cipriano, co-chair of UHC 2030. And Pam, can you share with us how the social participation agenda supports UHC on the ground and supports advancing UHC on the ground?
Thank you, Danny, and I appreciate IAPO and CSEM for holding this time together, because it really is critical that we look at how we come together to keep advancing the UHC agenda, because we know we are still behind. Half of the world's population still does not have access to the services they need, and half of that group, or 2 billion people, are suffering from financial hardship, which are, some of the principles that we have been placed at the top of what we want to achieve in terms of universal health coverage. So we have a way to go, and we know that we are behind. But one of the, several people have said, well, let's start with the positive. So if we acknowledge that we can't have business as usual right now because we are behind, and there are new growing financial challenges, both for the individual, our communities, and our systems. But maybe out of that, crisis comes an opportunity. And I think the resolution creates the platform for saying we must have civil society engagement. I'm always struck when we invite patients to the table. So I'm a nurse by background, I'm also president of the International Council of Nurses. But we'll invite a patient to tell their story. And people are like, oh my, I didn't know. Oh, that's so incredible. If we just amplify that, I mean, because this should not be token involvement. If we are involving civil society, if we are bringing together the social participation, then it's not just a single story. It is the influential voice about how do we need to restructure our systems? What are the priorities, particularly in times of fiscal austerity? What are the services that are needed? What are the services that are working? What do we stop doing? And I think it's this collaboration that has been missing or viewed as nice to have as opposed to truly essential business strategies. So if we're going to achieve UHC, we know that health systems must be people-centered and designed around their needs and preferences and the rights of participants. And co-designing, again, is critically important. Having co-governance so that we can make sure that we institutionalize social participation as part of the implementation of the resolution. We know that, again, equity is important, justice is important, and we do have to get it right. And I don't think we do that without all the right voices in the decision-making that has to occur. So we need structured platforms for individuals and communities, again, to kind of co-create the policies that are really important. And I think this is helpful too when we think about closing the gaps in access to services and addressing the struggles that billions of people have because they're denied their right to health and well-being and dignity. And again, this is everything from additional suppression of care for women and children and adolescents to really, again, looking at countries that have not built a robust set of health benefits as part of their universal health coverage commitments. And we know that even though, what'd you say, 194 countries signed on, we just like the political declaration for universal health coverage, we can't force countries to live up to their commitments. So we have to try our very best to influence them. And again, I think it is the social participation and that voice coming together of really expressing the need, really demanding that we are, again, patient-centered, that we're not forgetting our vulnerable and marginalized groups. So we need our governance to be inclusive so that we're providing the foundation for public trust. Many governments have lost the trust of their public, or they've seen their benefits not be delivered or not be provided, or changes that, again, have forced financial hardship. So we really need to take the opportunity out of this crisis to be able to say, we want to bring the whole of society approach to designing the best health systems, strengthening that we can in order to be able to deliver care consistently. So social participation is clearly a force for not only strengthening our systems, but demanding accountability. And so to be truly effective, we know that the mechanisms for participation required structured dialogue with our patients, patient organizations, civil society organizations, and all who are on the ground are indispensable in terms of aligning the reforms that are needed so that we make sure that no one is left behind.
Thank you, Pen. I know you touched on this, but I would love for you to elaborate a little bit more and let us know what role do you see for patient organizations as representatives of patients and people with lived experience to play in advancing UHC in cooperation with the wider civil society?
Thanks again, Danny. So some of the words that come out of the UHC compass that IAPO has put forward are voice, agency, and empowerment. And I think that really embodies what patient organizations can do and all civil society organizations that are representing the interest of people with lived experience. I would repeat again that I think it's important to recognize that those voices have not been present. And anybody in the healthcare community or the health policy community or those who are making the policies and governing in our government organizations can't fully appreciate those experiences unless it is heard from those individuals directly. I love Nanut's myth because I think those have been forces that have held back the lived experience and that patient voice. And yet it is so critical because I believe we have underestimated how again, how important it is to understand. Are there any other mics that are on? No. I don't know. Again, we've underestimated not only what is needed, but what are the impacts of services that are provided, or what is happening in the lack of services being provided. You know, what is happening with disease progression in people who are not treated? What is happening when we are not preventing certain kinds of diseases? We're seeing, a rise in mortality in babies that are not immunized. When we think about UHC and the benefits that should be provided from birth to palliative care at the end of life. And again, making sure we're addressing all of these needs. Civil society and social participation covers that gamut. We're having discussions about migrants and immigrants and what happens when they come into countries. Some countries are doing a great job in terms of recognizing that these are now people that need to be cared for within the insurance system. I mean, some countries, again, are doing a really good job. And I believe it is the voice of patient organization and civil society that are recognizing that there are groups whose voices are not heard, that need, again, to be brought forward. But there's really nothing more powerful than the lived experience. Again, when we think about financial protections, which is really UHC 2030 major emphasis for this year, is to say that we must understand what is happening. And again, because of the changing landscape globally, that services have actually stopped in many countries because of the removal of USAID monies and then other funders. Not that we can't come out of this perhaps in a very strong way where there's more money on the ground and there's more centered programs that eliminate duplication. But right now it is a gap. It is a gap that occurred very rapidly and people will die and already are dying. And so we have to think about how can this advocacy, because that's the other word we haven't talked about, agency for the individuals, but really advocacy that comes from civil society and our patient organizations. So I think bringing this all together to make sure that we can then have grassroots action as well as pull together the influence that's needed for our country leaders, particularly those that are in charge of making decisions and budget decisions about spending in health, because one of UHC's asks has been, we need to spend more in health. And we need to make sure that we have the workforce supported to deliver those services, but at the same time, what are those services? How do we need to make sure that we are inclusive? And we won't know what those things are unless we ask people with lived experience.
Thank you, Pam. I would now like to invite Gabrielle again to answer a question, but also John Collin. He's representing the WHO Civil Society Commission together with Ravi, but he's also wearing the hat of running an organization representing people with lived experience. And I would like to ask you both, how can patient organizations, it's a very similar question that I asked Pam, representing people with lived experience and patients contribute to all these challenges that we are seeing in the implementation of the resolution?
Thank you, Danny. Yes, so my name is John Coughlin. I'm the Secretary General of the International Cerebral Palsy Society. And so I want to share sort of a perspective here maybe of persons with disability are they patients? Are we part of the patient community or not? It's sometimes a sort of a sensitive question. Of course, persons with disability can get sick and then they are definitely patients. But in terms of their lived experience of disability, we've been seeing this shift over the years from what's been considered the medical model of disability as something to be cured to the social model of disability. And really one key factor in that change was actually the result of a resolution of WHA some years ago, which established the International Classification for Functioning Disability and Health. And this gave us a framework to think about disability in terms of not something to be cured, but as something that is due to an impairment, but also as it were imposed on us by society. Society disables people. And one of the key, because we're looking for metrics in that framework, was the concept that a key measurement for functioning and disability and health is participation. So back then we were already talking about participation focused on the individual and their capacity as a person with disability to participate in life around them as a key measurement of social inclusion and of our success, in fact, as a health system. So I think it's important from our perspective, from the disability rights perspective, to see participation as being a continuum from this individual level through to social participation, and that it is all part of a spectrum of engagement that is important for the ability of people with disabilities to engage. And at the moment, there is a new initiative which was launched or announced. It will be officially launched next month, but it was announced already by Dr. Tedros at the Global Disability Summit in April, which is a global initiative on health equity for persons with disabilities. Persons with disabilities obviously face health issues directly as a result of their disability, but they're also in the health system prone to suffering greater from lack of access to healthcare. This can be due to a lack of training of healthcare professionals, a lack of adequate equipment in hospitals and clinics, inaccessible buildings in which healthcare services are provided. But it also can be down to sheer prejudice and discrimination on the part of healthcare professionals. And this is something that we need to be open about and need to address. The result is that persons with disabilities have greater vulnerability to certain health conditions, have greater vulnerability in emergency situations, for example. But even in well-person contexts, it's more difficult for people with disabilities to access healthcare on an equitable basis. If we just focus in on cerebral palsy, a lot of people, well, everybody with cerebral palsy has a motor impairment, and it's a range, it's a spectrum, and many of them will be in wheelchairs, or will need postural support. And think about it, and I'll speak from personal experience here. I'm the father of a teenager with quite severe cerebral palsy. It's difficult to go to the dentist because you can't get into a situation in the wheelchair where you've got the right postural support for the dentist to be able to examine properly. It's difficult to get an ophthalmologist, it's always a difficult word to say, ophthalmological examination, because those machines that are generally used require you to sit up and face right up to the camera. And I want to go into the details of what it's like for our female colleagues trying to get good gynecological or obstetric care. And by the way, if you're interested in anything in more detail about cerebral palsy, we also have an official side event on Wednesday, if you allow that. Plug 7:30 in the Palais. Thank you. But back to this, it's the global initiative on health equity for persons with disabilities. So we described the problem, the challenges that we're facing, and working with WHO and organizations of persons with disabilities, what is one of the key drivers, as it were, to improve health equity for persons with disabilities? What it is, social participation. And so that is core to this new initiative. It is about, as Nanucci was saying, involving lived experience from the very beginning, co-designing. There's no need for all of these obstacles to access to healthcare if you just simply ask people with disabilities at the beginning of the process, what are the potential obstacles that we need to overcome. So I'd like to, last point, how can we contribute? I think it's the spirit of a slogan which started in the disability rights community, but which I think everybody can sign up to, which is nothing about us without us.
So from my perspective, the patients' organizations are at the very center of it. I know that there has been a lot of discussion about the language of the resolution, which is more inclusive in a way. I think it was a kind of known decision, something that was done on purpose to keep it actually as inclusive as possible. And we know that that language may actually be interpreted like, oh, it's not for the patient. But no, it is the patient. The patients are at the center. I really do believe that because of the changing global health financing and aid, many countries in the coming years, actually in the coming year, they will start preparing for structural reforms. That will mean changing fundamentally the way they design and they deliver services. And that's where I really see patients' organization being at the very center of participatory processes to help national authorities and governments to make the right choices. Because many of these people will know, because of the lived experience, what it's like to receive those services and how they can be embedded in new structures and what can be improved and what should be changed, what didn't work before. I think one of the things we have been discussing and disputing a lot with my colleagues when I was working back at the WHO Regional Office for Europe, we tend to work a lot with our colleagues in NCDs, and they have a really rich agenda, bringing on board people with lived experiences. And I think where it's still important that we try to make the connection is that when patients' organization, people with lived experiences help, for example, a specific clinic or hospital in a specific setting to improve the way they do things, it's wonderful, it's great. But what we are going after when we talk about social participation is a structural change at the system level, because we want to change the way in which the health system works, in which all citizens are receiving the services, and in the way in which each citizen has an entitlement and can have easier access to what they need. So I think the challenge, and maybe something that should be worked on, is how do we make sure that these voices are heard at the central level so that the change is systematic and not like that we don't stick to pockets of change where we try to make systematic change. I think that's a real challenge. And I mean, again, Thailand and Brazil, they have like amazing experiences of how they actually managed to bring this change and kind of spread it at the national level. So I think we need to learn from that. And but I really do see actually patients' organization playing a key role in this movement. Thank you.
Thank you. Thank you, Gabrielle and John, for bringing these insights and also reinforcing what we are talking here, which is the systemic change. And based on that, I would like to invite each one of you to share. I'll be very mean. On my briefing, I said one sentence, and now I'm going to ask you one word. What do you think would be the most important metric or indicator to include in the monitoring and reporting of the implementation of this resolution? We are talking a lot about it today. So Pam, you first.
In one word?
You can go more.
I'm going to have more than one word. So appointment to leadership roles in decision-making arenas that represent social participation.
Ravi.
Feedback. And in the sense that we're hearing from our people and that we're also sharing back with our people what we've learned. It's got to be two ways.
Almost the same. I think it's how social participation influence decisions, because it will convince both the governments and civil society and people how important social participation is. Because without feedback, without influence, civil society will be kind of don't trust social participation that government provided. And if there is no impact from social participation, government will not support it anymore. So impact from social participation is the must.
I mean, the word that would come to my immediately to me is equity, because this is what it is about. But being an economist by background, I like the idea of either impact or change. I mean, what I think we really want to see, and that's also I think what we'll be struggling, is people think social participation is kind of an aim in itself, like it's something, is a nice to have. No, it's not. It should be at the center. It should be. So I think we want to showcase that it can change and improve things. So impact and change. Thank you.
Example. So leading by example. And WHO, from HQ right through to country offices, has the opportunity to lead by example. So if we see that across the different thematic interactions and so forth, that the social participation is being implemented, then others will follow.
Thank you. And I'll also complement and say, for me, it's patient outcome. I want health systems to really deliver what patients need, not numbers or reduced spending and so on. We are running out of time, so I'll skip questions from the audience at this moment, and hopefully we'll have more time to allow you to ask questions. But I really wanted to say a huge thank you. I'm honored for us to have this discussion today, and I will carry on engaging. IAPO will carry on engaging with all of you for this resolution to continue to get out of the paper. Thank you so much.
Okay, can I invite our next panelists up, please? And in the interest of time, if you could just introduce yourselves as we invite you to speak. So we're now going to hear from the patient organizations who are actually helping to bring the resolution to life, from the collaborative efforts of the Global Patient Movement Catalyst to the Skin and Rare Diseases Resolution. And lastly, we're going to hear from Danny, who will talk about the tool in the form of the UHC Compass. Continued social participation in a local context is really imperative for the success of this initiative. So let's hear more about them. Thank you.
Hi, everyone. Apparently I'm starting. My name is Amanda Buck. I'm the Chief Partnership Officer at The Synergist. The Synergist is a nonprofit organization based in Brussels, but working on global programs. And as the name says, the whole purpose of our organization is to create synergies, which we do by bringing different sectors together and creating the environment, the trust building, and bringing in the methodologies and the facilitation for co-creating solutions that work for everyone. This morning's panel was very inspiring, so I'm immediately going to scratch everything that I prepared to say and quote from the people that spoke before us. Manut, you said something so beautiful when you said that government is too big to solve small problems and too small to solve big ones. It echoes very nicely with what we at the Patient Movement Catalyst, and by the way, I'm going to preface by saying many of you in the room are already part of this movement. Most of us at this table are already part of this movement. The Patient Movement Catalyst is really a coalition of the willing and a movement of the motivated to help create bridges between the big and the small. In a way, you can draw the parallel to patient organizations are too close to the problem to see the big macro solutions at their fingertips. And health systems are too far from the real world detail on the ground to really know what it is that is needed that would help health systems be stronger, save money while becoming more effective. And at the Patient Movement Catalyst, what all of us are doing, and I'm honored to sit next to two of our stewards, and Lara is one of our stewards as well, what we are trying to do is to justement co-create, all of us coming together as not just patient organizations, but also patient engagement experts and anyone that is passionate and believes in the power of lived experience to create the strategies that will bring these two worlds together, that will bring the grassroots and the treetops together. And that is a little bit of an introductory framing for the specific resolutions and the specific disease area and grouped area that we're going to hear about today, in order to showcase what patient organizations can really do when they become real, tangible, actionable partners to health systems. So with that intro, I'm going to pass the floor. I don't remember which one of you ladies. Is it? Okay. Jennifer.
Okay, so thanks, Amanda. It's a pleasure to be here. My name is Jennifer Austin, and I'm the CEO of Global Skin. Global Skin, the long name is the International Alliance of Dermatology Patient Organizations. And from the name, you can tell that we are an alliance, and we have more than 320 member organizations around the world, all groups that are supporting people living with the wide spectrum of skin diseases. And we have been part of the development of a resolution that's being led by Côte d'Ivoire and is before the World Health Assembly this week. It's quite a thrill for us to be here in Geneva for this very groundbreaking moment for our community. I just want to give a brief overview of the landscape that we are working within as a skin diseases community. The global burden of disease in 2021 pegged skin diseases as having 4.69 billion cases in that year. And it is among the top 10 causes of disability, having a skin condition. It's also one of the most common reasons that people seek healthcare. And so this is low-hanging fruit from a universal health coverage perspective. And that's certainly the aspect that we have focused on in calling for more action on skin diseases. Part of the big challenge with skin diseases is that general healthcare practitioners have very little training in dermatology. So people are going undiagnosed and sometimes undertreated or without treatment. There's a whole host of other challenges that I won't get into, but this means effectively that if we could provide more training, that we would see those top 10 common diseases, which make up actually a large proportion of skin diseases patients, being able to achieve universal health coverage, therefore strengthening healthcare systems. And so it does come down to what is the value that is provided, and so that's the landscape that we've been working in. Skin diseases patients are very underserved and often not heard, and so it was the feeling of our community. And when I say our community, it's not just the patient organizations, it's also the healthcare professionals that work with these patients. We really felt that those voices needed to be heard. And what better way to do that than to have it heard at the World Health Organization level. And so through lots of collaborative work with member states, we now have this resolution. And I'm not going to go into the details of the resolution. I will give a plug for the fact that we have a side event tomorrow evening at 6 p.m. And you can find out more information about that on the Global Skin website, globalskin.org. But I think that the key takeaway for us in being involved and working at the World Health Organization level of policymaking and working with member states is that patient organizations and others in civil society can really help to lead from behind, because ultimately this is resolutions are led by member states, but often member states are looking at it from the position of just their own country, and they need that global perspective to be able to come up with policies that are appealing across member states at the World Health Organization level. So I think that that's something that we've been able to bring to the table, because we have member organizations in 74 countries around the world, all WHO regions. So we have that perspective that we can bring to the table. We also have been working in close partnership with the International League of Dermatological Societies. So that's the physicians, and they have the subject matter expertise on the diseases themselves. Also, access to lots of research and data that helps to make the case for why we are seeking policy change and for policy elevation of skin diseases. So we all shared this vision, and were able to cooperate and to work with member states in a very co-creative way. And I really loved what Nanut said earlier, which is that basically, we should be considered valued assets, and that myth that it takes longer to do social participation. I would argue in this situation, because we did work so collaboratively, that we actually worked faster, much, much faster. I think we were able to do things together with the member states that I would never have imagined could happen in this shorter period of time. So thank you.
Hello, everyone. Being the last speaker is not so easy because you really have to find what has not been said. A lot of good things have been said today. So I'm going to try to elaborate. I had some key points that I'm not going to go through. So first, I recognize a lot of familiar face in the audience. So I thank the member of ADI to be here. So I'm the CEO of Rare Diseases International, the Global Alliance of Persons Living with Rare Diseases. As Global Skin, we also have a resolution that hopefully will be adopted this week. This is the first time that there is a resolution on rare disease here at the World Health Assembly. That resolution will call the WHO to develop a global action plan. And why we did emphasize from the very beginning the importance of having a global action plan. It's because it will create accountability and monitoring. So I heard in the previous panel that monitoring was also something very important to assess really where are the gaps, the gap of the social participation, the gap of the patient engagement. So this is what we hope with this resolution calling for a global action plan that we will manage to do. So having a framework for action that will help member states to know what to do. Because in fact, even if there is a political will to improve the life of persons living with rare diseases, often countries just don't have the guidance. Or patient organizations in the country also do not know how to do, what to do. So we believe by having also those frameworks, we create a path for action, a path for accountability, monitoring, target indicators, etc. I would like to react to one thing that have been said at the end of the first panel, which was the distinction between individual voice and social participation. And as a representative of patient organization, you can imagine how many parents and patient itself, are part of our organization. And our duty is to represent their voice. But if we really want to influence the ecosystem and create an impact on advocacy, we have to somehow create that social participation. So this is a translation from individual voice to social participation. And I think I heard there will be a framework, or there is a framework for social participation. Yeah, because indeed it will be the only way to catalyze and to provide the guidance that is necessary for all the different actors to really know what to do. And the ultimate point I wanted to emphasize is we are all here, I think, in this week and the previous year of the World Health Assembly to improve equity. I think if we are all here today pushing for our agenda, pushing for resolution, etc., is because we want that the most vulnerable people are better recognized. So again, thank you for the initiative on this social participation resolution. I hope that we will also learn from your experience, because both of us, we are going to really have to mobilize effort after the adoption. The adoption is one thing, but implementation will be really the hard phase. So we really look forward to continuing supporting your work on social participation and learn from your experience as well, because at the end of the day, it's it's the same topic that we are talking about. Thank you.
And I just wanted to let you know that at the end of the event, you see a QR code here where you'll find more information about the side event from Global Skin and Rare Diseases International, but also the UHC Compass that I'm going to very briefly introduce to you. And building on what Alex just said, that how much a global action plan is important, because that will guide governments at the country level. I'm going to talk about a tool that was created to guide patient organizations on the ground to work with universal health coverage. And it was a tool designed for patients, of course, but with them. And it was based on the need to include the voice of the patients and people with lived experience in those political discussions about universal health coverage happening at the global, but also country level, and prepare them to play a more active role in decision-making processes related to health. This tool is a mix of knowledge about UHC based on previous tools that were developed by UHC2030, CSEM, and other organizations, but with an extra bit about bringing case studies and projects, best practices from the patient organization movement. And I think what's makes the UHC Compass very unique is that it has two sections on assessments that the organization can make to really understand what they are working on, what are their main assets, what these are, how these link with universal health coverage. And based on their priorities, on what the work that they do, how they can advance universal health coverage on the ground. This UHC Compass, I think it links so well with the patient movement catalyst that Amanda just mentioned, because it's a way of making it concrete on the ground, but also hopefully will be a tool for patient organizations to help in the implementation of the global action plans on skin diseases and rare diseases, which will hopefully be approved this week. And I would love to invite you all to collaborate with us, because this tool is now a big tool, but it was created to be a living document. It's something that we will continue to improve. We'll continue to add more knowledge when it comes. We'll add more case studies. We are digitalizing this tool so it's more accessible and friendly to be used. And also, I invite you to share it widely so more organizations, more patients can use and access it. Thank you.
Thanks so much, Danny. Thank you to all the speakers. I'd like to close with a question for you all. What would be your key ask to governments to ensure the meaningful engagement of people with lived experience in health decision-making at the national level? Alex, I'll start with you. Yeah, exactly. Now you can go first.
What would be the key words? Key ask to international engagement. Yeah, it's a dialogue and transparency as well. Because often we don't know what's going on. For example, we don't know what's going on with our resolution. It's difficult sometimes to have some insight. We know the context today, that with all the budget cuts, and at the moment, nothing is being said. So we just have assumption, and I think it's difficult. It's difficult, particularly when civil society is so much engaged through the process. So even for after, if the resolution is adopted and we'll have to implement, the dialogue with all the stakeholders, formal consultation, knowing about the process as well. What's going to be the process after? How can we, as umbrella organization, making sure that we prepare our community? At the moment, everything is very in the gray area. So I would say transparency and dialogue. Thank you.
Amanda.
I was preparing to go rest, but that's okay. Thank you. My message would be investment. And I'm not just talking about resources, financial resources, although we all know we need those. I'm talking about investing in creating the enabling conditions. We know that we need a shift in mindset. We know that we need capacity building. And those things are learned by doing. So we need to invest the good faith. We need to invest the opportunity to make that happen and then to scale it and to grow it. And so I think, yeah, that would be my key message. I think I want to leave us with the idea that in the changing environment, and we're all aware of the fact that we're just layering instead of decreasing the challenges to our societies, we need to move from a mindset of scarcity to a mindset of regeneration. And if not investing in our people, what force is more regenerative than that of people?
I think that the Civil Society Commission's model is really commendable, and I do wonder if there would be ways to implement that more at a national level, because I think that the challenge for civil society is trying to find the ways to get involved. And I know myself as a patient advocate and just even as an advocate, as a citizen in my own country, you're constantly trying to find the hook into where you can insert yourself. It's not necessarily a welcoming environment. It's not actually seeking it out. So creating the conditions where civil society, and particularly people with lived experience, feel comfortable and welcomed into the process, I think would be great. And ensuring that patient organizations are a key part of that, because they truly are channels to large groups of patients. You don't have to work very hard to find patients if you're working with the patient organizations, because they are the ones that are in the know, they are the ones that are connected, and they ultimately know how best to engage with and interact with patients. So they're important in the design of consultations, not just to be consulted with, to get their views, but to actually be part of designing how to engage the patients for the best successful outcomes for the policymaking.
Of course, all of this, and I'll add accountability. So you open the door for us to speak. You invest money, resources, create this framework for us to engage, but then you have to carry on and do it, and then report back to us and continue doing it in a systematic way.
Fantastic. I mean, really great words to end on. Dialogue, transparency, investment, accountability. I think if we get those things right, we've got a long way to go. So thank you to all our speakers. Danny, I'm going to hand to you now to close our event.
Well, thank you. Yeah.
Do we want some questions from the
I
audience?
was ready. Yeah, we have 5 minutes. I'll make sure I'll do my closing very quick.
Okay. Do we have any questions from the audience? Yes, at the back there.
Yeah, thank you. Thank you so much. My name is Fred Banza. I'm a member of WHA78, which is a Vitiligo International Patient Organization Committee. So I really appreciate what you said, but I'd like just to get a clarification on because there'll be a resolution on the rare disease, and then another one on the skin disease, which will be considered as a public health priority. So how will be that integrated in terms of, when it will come to actions and whatever? Because there are some rare disease that are considered in the skin diseases. So I don't know how, at what extent we going to collaborate.
I was just going to quickly say that those diseases that are in both camps, both the skin diseases and the rare diseases, I think are especially lucky. And we've been saying that, I think, inside our own community, that, wow, what a moment for anybody with a rare skin condition. But I think you do raise an important comment about the coordination. And I think it will be really important that people in those communities are part of any consultations that go on, hopefully once the resolutions are adopted in the development of the global action plans. Alexandra?
Absolutely correct, Jennifer. We work closely together. What perhaps could help to understand is that rare disease resolution would really be will address the common challenges of every rare disease. So it will be a much more high level somehow framework. And then when we will develop the global action plan, what we will need is definitely some very specific input of specific rare diseases to make sure that what's going to shape the global action plan or what the action target indicators will be reflect somehow the need of the specific diseases and region. So it will be a hard task to do if we arrive there. But as Jennifer said, I think there is a common ground for sure. So it will be about collaborating together. It will amplify for sure the challenges of the skin rare diseases, but in the rare disease resolution, there would be also so many other specific diseases that will need to be profiled as well. So we will address certainly the common challenges and common solution. So it will be transversal, like integrating rare disease into primary healthcare, integrating rare disease into UHC, etc. We will have a transversal approach to all rare disease, while the skin resolution will dig into what is needed for the skin disease, including rare skin disease.
Any other questions?
Hi there, my name's Helen Hamilton and I work for WHA78. I wanted to ask the panel, it's such a fascinating discussion, so thank you first of all. We hear a lot from civil society in the work that WHA78 does, that one of their top demands is clean healthcare facilities, having running water. We know that for anybody who's in a marginalised group, these are one of the essentials, particularly if you're managing skin diseases in many situations. But what we don't always see is systematic responsiveness from the health system to meet these demands. You know, there's very clear presentation of the demands, good coordination mechanisms, but not necessarily the responsiveness of the system. So I'd love to hear the panel's reflections on what are some of the success factors, particularly for low-income countries, that can help bring that system responsiveness to the forefront and enable systems to do better in meeting those demands and rights to health.
Hi, I'm Ritu. I don't have a question really, but more of a thought, and I'm thinking aloud as I'm speaking. But I'm very aware that we are talking about collaboration across the globe and social participation for better health outcomes. But I'm just aware that we are sitting in Geneva and 60% of the world's population is in Asia Pacific, almost 75% in the global South. And it's just a moment, I think, to remind ourselves that it's imperative that we think about and strive to engage people who can't be here, who aren't here, and who can't be here. And these are the people who will benefit most from social participation. And well, yes, while our gaze is so keen on the two resolutions that we hope will be adopted this month, at the same time, it's really important to look down at the grassroots, particularly in the global South, at the populations who really need this change, who really need the impact, who really need to be engaged. So wonderful to see Thailand here, but hope to see more representation from outside of the high-income countries. Thank you.
Can I respond very quickly to the second question of Ritu? I think she's raising a very good point, and I did an emphasis during my first, when I spoke about the resolution. That resolution has been really developed. Well, the call first for the resolution was 1 year ago when we were all here in WHA. So it's the civil society of the rare disease that called for it. And then it's a member state driven, so the member state took over and developed the resolution itself. But the role of the civil society from every region was critical. And the role of umbrella organization like ADI, for example, is to ensure that the voice of our members in each region is feed really what could be, for example, the global action plan. So quite confident that we will be able to ensure that the realities across the world will be reflected, and this is definitely the role of LEI with the policymakers to work towards that. But it's a very important point to have in mind.
And I can try to answer the first question. I don't think I'm going to answer it as much as I'm going to encourage you to continue that conversation. I think that we are all aware and are increasingly seeing the effort to collaborate between the environment sector and the health sector. We saw important resolutions coming out of WHA last year. Equally, we see UNFCCC and the climate change conferences mentioning health more and more. At a civil society level, and underneath that, at the level of lived experience, I think you're making the point, you're illustrating very colorfully the point that we're all trying to make, which is we need to start with what is the lived experience in that hospital for that patient lacking access to clean water, and build up from there. So I don't have an answer for you other than that I love the question, and please ask it in more fora.
One more question.
Okay, Danny, over to you.
So that leads me to the closing. Firstly, thank you so much, Jennifer, Amanda, Alex, Lara, for moderating this session, but also all other speakers who were part of the first panel. John, Anout, Gabrielle, Ravi. I'm very, very grateful for all of you to make the time to be here. And also I'd like to extend my thank you to CSEM. It's been a pleasure working with you and bringing the patient community closer and closer to the wider civil society community. We can do so much together, and we are already doing so much together. Of course, this event doesn't stop here. This is a moment building on what we started last year with another side event in collaboration with great partners, the Synergies who are here today, Amanda representing them, but also how much we have been investing in collaborations and exchange of experiences, practices, and seeing how we can connect more and more to be able to support the implementation of the social participation. And of course, what's coming next, the patient charter. I'm super happy that resonated well with the other panelists, and I appreciate Ravi to raising the idea of taking this further to the wider civil society commission. And finally, I would love for you to take a few minutes to scan the QR code up there. Hopefully it will show up where you can learn more about the side events that Alex and Jennifer are holding about the resolutions where that they are collaborating with, but also you have the possibility to access the UHC Compass that I just presented to you. So thank you so much for making the time. It was a big pleasure to be holding this side event here today. And I hope to connect with all of you very soon and see you around at the World Health Assembly. Thank you.